Malaria cases have reached a 40-year high in the United States. That's according to new data released by the Centers for Disease Control and Prevention. The CDC's latest information is from 2011, and it shows just a little more than 1,900 Americans contracted the mosquito-borne illness that year. 5 people died from the illness. The CDC reports the number of Americans getting the disease jumped 14% from just the year before. Most of the cases came in January and August, right after the winter and summer travel seasons. About 70% of all the reported malaria cases in 2011 were from people who had traveled to Africa, where malaria is the most common. Most of the other travelers visited India. Of the nearly 2,000 reported cases, only 5 originated in the U.S. 2 babies died from complications after their mothers traveled overseas, and others involved a lab accident and a blood transfusion. Of course, it's a much larger problem worldwide. There were more than 600,000 malaria deaths worldwide in 2010, and more than 200 million people overall were infected. Live Science reports malaria is preventable. Some of the most effective measures are wearing insect repellent, wearing protective clothing, and, most importantly, taking anti-malaria drugs before traveling. So far, it's not clear what caused the uptick in malaria cases. Doctors say it's always a good idea to consult a healthcare professional before traveling overseas to places known for having malaria outbreaks. For Newsy, I'm Jasmine Bailey.